management of crying child, mostly neonate and infants. The excessive crying, inconsolable crying, usually means there is an unwell-being, some sort of bad things, a sickness is going on. He must be hungry or he is sick. So sickness is usually in the upper respiratory tract, otitis media, and your lower respiratory or pneumonia, infective causes. So look at the throat, look at the ear, and your count the respiratory rate, and assess whether it is pneumonia, simple pneumonia maybe mostly, or the otitis media and throat infection. Next step is evaluate what is being fed. Breastfed infants were, and whether he is giving some unusual things, the rice powder, your shuji, and then dilute feeding. These are also important causes of crying because the child remains hungry. Infrequent feed also keeps child hungry, and thereby he or she cries inconsolably. Dilute feeding also, and inappropriate feeding. Assess the intestinal abdominal causes. Mother will say, "Look, she has a tummy pain." This is not always the case. It is a layman perception. You assess the abdominal pain illness, ask about the diarrhea, palpate it, soft tenderness, bowel sound, etc. Normal, nothing. So exclude those things, and then urinary tract infection, even septicemia, severe early signs of severe infections can be there. So look at those things: lethargy, fever, toxicity, and not being able to suck, and all this and that. See those things, and if they are not, they are well child. So exclude those things, and they are auscultate the abdomen and look for the bowel sound, and also you see the neck rigidity, carnic sign, and your also uh, look the unrecognized trauma, and other issues, emotional deprivation, etc. So don't jump unnecessary investigations. Don't sedate with the phenobarbital, trichlorophos, and other so-called anti-crying elements, so that is sedatives. And there is usually an underlying diagnosis, and address that diagnosis to have the eventful recovery. In our early days, we used gripe water, which has alcohol, and your trichlorophos and other sedatives, phenobab and others. Nowadays, people do not use those things. They rather meticulously look for this cause of the crime and address that cause.